Thank you for being here. This is a tremendous opportunity for us. And I want to thank Leland for the invitation to be here. We have an unprecedented opportunity sort of to change the path to make America healthy again. And I'm a professor at the University of South Florida, Morsani College of Medicine. And I was trained in nutrition, neuroscience, and physiology. And they're subjects that I teach at the undergrad level, at the master's level, PhD, and also medical students. Our medical students actually have a front row seat in the chronic problem that is facing the United States today. They see that Americans are eating themselves sick. So they actually see 60 to 70% of the patients that come into the clinic. For the third and fourth year medical students that I see, they have a diet-related chronic disease. But the system that they work in basically quickly pulls out a prescription pad. So they are treating a dietary disorder with drugs. So the path forward is very clear to all of us. And I can tell you, as someone who teaches hundreds of medical students, that they are excited about the movement to make America healthy again, and they view food as medicine. So really the path forward is that nutrition really needs to be taught in medical schools, and we are one of the very few minority of medical schools that do that. And I want to say that it did not come from the administrative level, it came from the bottom up. So the students saw that they were not taught nutrition science, but they needed it to effectively practice medicine and treat chronic illness. So also, we need policies in place to make nutrition science and also the practice of nutrition in a way that can be implemented. So today, you're going to hear stories that are really all about stories that you're going to hear about making implementation of nutrition therapies, in particular, carbohydrate therapeutic reduction or restriction as a powerful metabolic tool for the metabolic management of disease processes, for prevention, and also for reversing chronic disorders. So we have our first speaker today. I'd like to introduce a colleague of mine that's near and dear to my heart, friend and colleague, Dr. Andrew Kutnick. He is an award-winning research scientist recognized for his leadership at the forefront of diabetes research, of chronic disease research, integrating nutrition and metabolism to set the international standards for therapeutic guidelines in diabetes. He has over $70 million, has acquired $70 million in research funding and has over 100 peer-reviewed publications. And he's also given numerous international talks. So without further ado, I want to introduce Dr. Andrew Kutnick.
So I tend to go pretty off script sometimes, but I know we're time limit, so I'm going to be very strict here and just stick to the clear message here. So it's an honor to be here today. I think we have an incredible opportunity in front of us, and I'm not just speaking to you all as a researcher. I'm also a patient. I was actually diagnosed with an irreversible metabolic condition or chronic disease, actually 5 minutes from where we're sitting here today. And I spent the next 2 decades studying metabolism both as a root cause, but as a proven solution for multiple chronic diseases. I am here for you today as the longest studied juvenile diabetes patient in the medical literature to sustain therapeutic carbohydrate reduction for over 10 years, despite all evidence showing I and many other children who are diagnosed with this disease in adolescence are going to get rapid cardiovascular disease, atherosclerotic progression, which shows signs of this within 3 years, brain damage, neurological development within 4 years, brittle bones, deteriorated kidney health, potential dialysis, and some form of eye damage and retinopathy by the time I was 30 years of age. I refuse to accept those outcomes, and I encourage other people to do the exact same. Despite decades of medicinal and technological advancements, there is still no technology or pharmaceutical intervention that normalizes my disease or prevents its ravaging and chronic damage. Our research team, including Harvard Medical School, Boston Children's Hospital, and University of Washington, analyzed over 26,000 patients with juvenile diabetes. In the most expansive study to date, we demonstrated that reducing carbohydrates in a dose-dependent manner normalized glycemic control, reduced insulin, and also medication requirements for this disease. Again, in a direct dose-dependent manner. But my journey sustaining therapeutic carbohydrate reduction for over a decade, as well as many, thousands of patients with this same exact disease, reveals a truth that extends far beyond juvenile diabetes. This powerful targeted approach is not just a theory. It's a proven intervention reshaping not just management of chronic illnesses such as my own, but more importantly, prevention and reversal. Looking around this room, so how many people in this room have heard of metabolism before? Excellent. Well, unfortunately, 9 out of 10 of us have suboptimal metabolic health. In fact, 93% of Americans have some form of suboptimal metabolic health. But more concerning than that is that 80% of us don't actually know it. And ultimately, this is driving skyrocketing rates, progression, even worsening symptoms of things like obesity, prediabetes, type 2 diabetes, Alzheimer's, Parkinson's, and even psychiatric disorders, which we'll hear a little bit more in a minute. But we know that therapeutic carbohydrate reduction as a proven intervention is not just clinically validated, but it's a rapid tool for not only preventing and reversing things like obesity, prediabetes, and type 2 diabetes, but also alleviating symptoms of Alzheimer's and Parkinson's, and emerging evidence showing the potential of its use in psychiatric disorders. Instead of costing the healthcare system $15,000 to $20,000 per patient, these interventions have been shown to save upwards of $5,000 to $11,000 per patient per year. This is quite a distinguishing aspect of this type of intervention versus others. Yet, our own USDA guidelines are unequipped to integrate these therapeutic strategies. The American Diabetes Association offers no roadmap for applying carbohydrate restriction or reduction in diseases like juvenile diabetes. And the governing bodies, like the American Academy of Pediatrics, actively discourages children from doing these interventions, despite the youngest patients being in the most vulnerable position. We should not and cannot wait. We must reform federal and institutional nutrition policies to reflect the overwhelming clinical and epidemiological evidence on this proven therapy strategy. Without clear guidance, clinicians are unprepared and in many cases dissuaded from applying these interventions for patients. To foster this change, we must, number one, add routine metabolic screening into clinical standard of care. Mandate tests like fasting metabolism or fasting metabolic tests like fasting insulin and glucose levels. Expand Medicaid, Medicare for the most vulnerable for medical nutrition therapy, continuous ketone and glucose monitoring, and digital dietary tools, and ultimately provide additional coverage for patients who are suffering from diseases outside of this, including obesity, cardiovascular disease, liver disease, bipolar disorder, major depressive disorder, schizophrenia, neurological disorders, cancer, polycystic ovarian syndrome, and infertility. We have an incredible opportunity, and that demands urgency, and we must act now. Now, I have my honor of introducing Dr. Malaria here. She is a Harvard and Columbia trained endocrinologist who brings over two decades of experience in diabetes care and truly a passionate commitment, I've gotten to know her for quite some time now, to transform treatment protocols. Her visionary, evidence-based approach for helping thousands of patients not just manage disease, but actually achieve remission, which is largely believed to be impossible by many, for type 2 diabetes. And more than anything, she's actually saving the lives of patients just like me. So it's an honor.
Wow, great. I'm actually going to stand up. All right. Well, it's in a really good segue what you just said, because my dad has type 1 diabetes, and I think that played a really huge role in me becoming a doctor today. And it's just very pertinent. So anyway, I just want to say thank you so much for this opportunity. It is so inspiring and fantastic to be here with all of you today. I really couldn't be happier because this really is a very, very interesting time. So I am Mariela Glant. I'm Dr. Mariela Glant. I'm an endocrinologist. I've been treating diabetes for decades, tens of thousands of patients. I've seen the diabetes epidemic just explode before my eyes since medical school. And you know, at the beginning of my career, I was actually pretty good at managing diabetes. I was really good at maintaining really good blood glucose levels, adjusting medications and doses, prescribing the latest and the best medications. But my patients didn't really improve that much, even though they went to the gym and they really tried the hardest to eat those whole grains and those lean meats and those fruits and vegetables. I never got them off medications. In fact, over and over time, I would need to add more and more medications because diabetes, as we're told, is a progressive disease. So if you want to maintain them well controlled, you have to add more and more medications. And we're mostly taught that our job is to manage diabetes. Well, 10 years ago, I ran into a body of medical literature showing that diabetes doesn't have to just be managed, it can actually be reversed when we address the root cause, insulin resistance. So it turns out that type 2 diabetes is really the body is just saying, hey, stop, I cannot deal with this much sugar and carbohydrate. This is all. So if I want to reverse it, I just need to remove the offending agent. I need to eliminate the carbs, and diabetes fades. And it turns out that carbohydrates are not essential nutrients. Even the National Academy of Science says so, because our livers really know how to make the right amount of glucose. All the glucose we need is made by gluconeogenesis in the liver. So I started prescribing a well-formulated diet, one low in carbohydrates and very rich in natural proteins and fats. And so at that point, the sugar starts to go down, normalizes, body starts to heal, and I get to peel away medications. So my first patient on this protocol over 10 years ago did really well right up front. He lost 60 pounds in 6 months. His A1C completely normalized from an A1C of 10 to 5.4. We were able to stop all meds, including insulin, and it was great. But even more great was the fact that the fear was gone. He had hope. He was empowered because his whole life, he was made to feel that his obesity was his fault. And he understood that no, actually, when I'm given the right advice, I have control over my health. And this was so empowering. Now, to me, this was transformative. As a doctor, wow, I was like, this is, once you see this, you cannot unsee this. So I started prescribing. And after prescribing some 4,000 patients with a ketogenic diet or a therapeutic carbohydrate restriction, there are many names for this diet, then I went on to found Ona Health to scale this and to make this available. This approach, I wanted to reach everywhere, especially Medicaid patients. And we are reversing their diabetes, not just managing it. And we're doing it at a fraction of a cost of traditional therapies. And we have a hell of a job because we have 40 million Americans with diabetes and 100 million with prediabetes. This means the treatment is a staggering cost of $400 billion if you factor in the amputations, the heart attacks, the dialysis, the depression, and all the things that come along with type 2 diabetes. But the good news is that ketogenic diets are therapeutic, they're medicinal, they're curative. There is so much evidence for them that if this had been a drug, it would have gotten FDA approval years ago. In fact, the ADA did state that this is the diet with the most evidence behind it. And the former head of the ADA, Tracy Brown, actually reversed her own diabetes with a ketogenic diet because it works. It actually works. So here we are, a really amazing opportunity to change the health of America. And I'm really optimistic. I think this is time. It's really time for people to know that a solution already exists. There is already a treatment out there that is humane, that is affordable, that tackles the real root cause of disease, while at the same time, it gives them energy, it decreases sugar cravings, and it leads to lasting satiety. So imagine if the impact, if federal funding could just help us put pilots all over the country, really to really help millions, to especially Medicaid pilots, to really reverse disease. And imagine if we could prescribe food as medicine to really provide access to healthy food. Well, food as medicine is not just a slogan. It is really a national, it's absolute priority. We must do this. It's an imperative. And I really believe that with strong policy support, we can actually reverse chronic disease at scale. The evidence is there, we have the tools in our hands, and the time is now. So thank you. And now I would like to introduce Dr. Matt Bernstein, a dear friend and colleague, just so honored to be next to you. And a practicing psychiatrist. I know you're gonna say more words about yourself, but yeah, thank you.
Yes, thank you. Thank you. It's really a privilege to be here amongst all of you and with these distinguished colleagues. As Mariella said, I'm Matt Bernstein. I'm a practicing psychiatrist. I've been so for 25 years. I trained at the University of Pennsylvania and at Harvard. I've worked in some challenging clinical settings, including the inpatient schizophrenia and bipolar unit at McLean, and some psychosocial rehabilitation programs with people with really severe mental illness. And I've taught medical students and residents at Harvard. I guess I'm supposed to say that these are the views of myself, not of my institutions. But I strongly stand by these views. So I've done everything in our field that trained us to do: medications, therapy, long-term psychosocial support. And yet, even with all that effort from me and especially from the people I'm working with, full recovery is extremely rare for the people that I work with. That changed 4 years ago when I discovered something that reshaped my understanding of mental illness: metabolic therapy, specifically the use of ketogenic diets and other interventions that target the brain's metabolism. We heard this morning from a young man who used the ketogenic diet to put his OCD completely into remission. This is the kind of thing that I'm seeing all the time. I'm seeing extraordinary things. So I'll tell you a story about someone who I saw recently. This is Mary, who's 45. She has bipolar disorder, PTSD, a history of alcohol dependence and long-standing remission. She's smart, she's funny. She actually worked very hard to become a therapist herself. And she's deeply connected to her AA community and her family. But despite all of this, she comes to me, she's on 6 different psychiatric medications, and this is very common in my field. And despite being on those medications, her symptoms continued: mood instability, depressions, manias, anxieties, hospitalizations, things that are extremely disruptive. And of course, she had metabolic syndrome from the medications. She had been put on a GLP-1 medication about a year ago. She had lost some of the weight, but she confided in me that she was addicted to sugar. She was still eating essentially cookies and ice cream and not much else. So we made a bold shift together. I put her on a therapeutic ketogenic diet with other metabolic interventions. And 8 weeks later, she comes back to me and says, "I've never felt this good in my entire life, and I am not manic. This is real. I finally feel in control of my health." That kind of transformation is no longer rare in my practice. I've seen patients with depression, bipolar disorder, even psychotic illnesses improve dramatically, not by adding medications or therapies, but by addressing what was broken underneath, their metabolism. In my entire career, I haven't seen anything else that reduces symptoms, lowers medication use, and restores vitality in the way this does. It gives people their energy, it gives people clarity, and their hope back. It's the foundation they need to rebuild their lives. And that brings me to a difficult truth. My field of psychiatry has missed something really big. Since 1980, the American Psychiatric Association has used a diagnostic system that merely names symptoms and largely ignores any root cause for why those exist. And if we don't know why something is happening or why someone is suffering, how can we truly help them? But now we do know more. One of the biggest drivers of mental illness is actually metabolic dysfunction, just like in diabetes that we heard about before. Mental health conditions, depression, bipolar disorder, schizophrenia, are all closely linked to these metabolic disorders like diabetes, obesity, and cardiovascular disease. These are not coincidences. They share common biological pathways. And we know what those pathways are. It's insulin resistance, it's mitochondrial dysfunction, oxidative stress, and inflammation. They all contribute to both metabolic and mental health disorders. And we already have a powerful intervention, the ketogenic diet, that targets these exact mechanisms. It's been used for over 100 years to treat epilepsy, over 300 years to treat obesity and diabetes, and now early research and clinical experience show that it can help people with psychiatric conditions too. We have some case series, we have pilot trials, and we actually have hundreds of anecdotal reports from people who have changed their lives. More rigorous trials are underway now. There are randomized controlled trials happening as we speak that will be published in the next couple of years. So what do we need now? We need funding to scale this research. We need more of it and sooner. We need training for clinicians, mental health clinicians, in metabolic medicine and in nutrition. We need coverage for metabolic screening tools and therapeutic nutrition. And we need policy that supports and not hinders these approaches. Because if metabolic dysfunction is a root cause, which I know that it is, then metabolic therapy must be part of the treatment and part of prevention. This is not fringe. This is not theoretical. It's evidence-based. It's clinically grounded. It's backed by what I've seen again and again. We are standing on the brink of a major breakthrough in psychiatry, one that doesn't just manage illness, but actually heals people from the inside out. And most importantly, it restores their dignity, their clarity, and their power. So let's stop settling for chronic. Let's stop accepting suffering as inevitable if we treat the root cause. Because when we heal the brain's metabolism, we can actually help people get their lives back. Thank you.
The prevention, the management, and then reversal of chronic disease is a fixable problem. And we've heard about how therapeutic carbohydrate reduction, also called the ketogenic diet, which I've been studying for the last 20 years, is a powerful tool and a lever to improve metabolic health and metabolically manage diseases that are completely refractory to drug therapy. For example, epilepsy. When drugs fail for epilepsy, kids are put on a ketogenic diet, and about 60% or more of them respond and then can get off all their drugs. And some of them are super responders. They get no seizures, they can come off of the diet, and it cures their epilepsy. So this requires, fixing the problem really requires an audacious plan to make America healthy again, and this is going to require a collaborative synergy between the National Institutes of Health, the FDA, academia. We need to teach medical students the need for nutrition, not to replace drugs, but to work complementary with drugs, but to be a frontline approach. So right now, nutrition is not thought of as a frontline approach. And we need collaborative synergy with government agencies, as I mentioned, academia, but also farming. I'm a regenerative farming. I have grass-fed cows and sheep, and I can see the power of farming as actually improving the environment around me when it's done properly with regenerative farming. And I think there's also a tremendous opportunity with industry. We could carve a path forward that is profitable for many industries that can provide a service, like for example, Ona Health, to help us make America healthy again and restore metabolic health. So, and I also think the media plays an important role. So share this information, get out there. What you learned today is going to be incredibly important for our path forward. So thank you all for your attention, and once again, I really appreciate the opportunity for us to be here to share our collaborative knowledge.